you so much for joining us today, Dr. Ho.
Hey, thank you for having me.
Let's start off by talking about your background. Can you tell us a little bit more about yourself, what you do, and what you may be involved with in healthcare policy?
Yeah, absolutely. I am currently a resident physician in emergency medicine. Since medical school, I've been really involved with various medical organizations, mostly American Medical Association. I've held titles on American Medical Association's Political Action Committee as part of their board of directors. I'm currently on the board of directors for American Academy of Emergency Medicine. I've been on various chair and vice chair positions for legislative and advocacy committees in other state and national medical societies. I've been working on healthcare policy for like 5 or 6 years already. Have seen the changes from major legislative wins, like when we changed one of the Medicare reimbursement laws that have been around for decades. And as a result, I've also been doing a lot of writing on medical education, healthcare policy, and ethics within medicine, and things like the Chicago Tribune and Forbes and NPR.
Why should pre-medical and medical students care about the Affordable Care Act?
So the Affordable Care Act is probably the biggest legislative change in healthcare ever since the New Deal. So understanding the rules of healthcare and understanding the rules of the game is really important before going into it, because it's like knowing, the syllabus for a class before you take it. It's like knowing how a test is going to be graded. That being said, Obamacare is the new paradigm of how healthcare is going to be delivered, how you're going to be graded on healthcare, and how healthcare is going to be accessed. As a result, the way that American healthcare is going to be for decades is going to be shaped by those entering healthcare, the ones that aren't used to the old system, the ones that don't need a cultural shift, they just need to come in and learn the new system. And so leadership and innovation is all going to come from the current medical and pre-medical students. Important things to know for Obamacare as a future doctor is primarily, what does it mean to be a doctor now? One of the big changes in Obamacare is that reimbursement for primary specialties like internal medicine, family medicine is going to go up. The trend for the past few decades is that things that your primary care doctor is doing has been going down for the amount of money they're getting for it. As a result, people are going to medical school, getting a bunch of loans, and not seeing the reason as to why they want to go into primary care and basically not be able to pay off their loans. Obamacare has changed that. I think as trainees, there are some pretty major changes also, especially for pre-medical students. They'll have good news in that medical school spots are being expanded, which means that it should be a lot easier to get into medical school. And the reason for that is that the ACA has noticed that there is a physician shortage and the patient population is aging and they will all need doctors. So expanding medical school spots was their solution to that. I think we do have to mention the flip side of that, which is that residency spots are not expanding, and residency is a necessary prerequisite to ever become a practicing physician. You can graduate medical school, have an MD, and you will not be able to practice until you at least finish a year of residency. So residency funding is tied with Medicare, and while Medicare actually got expanded by Obamacare, the funding part of it that goes into funding residency jobs did not get expanded. So you have more people that are graduating medical school, but less, residency spots for them, which might make it a little bit of a
more
tougher
difficult
squeeze.
Yeah.
Exactly. So the last major change for trainees is, as someone that wants to go into medicine, I think the motivation structures are a little bit different. As I alluded to previously, medicine is no longer like the cash cow that it was. So going into it for money is absolutely the wrong solution. I also think that the olden days of hanging up your own shingle and putting out your name and being a solo practitioner is gone. So I think that people that traditionally went into medicine because they wanted to be their own boss, because they wanted to be a small businessman, will find themselves pretty dissatisfied because things are team-based, and solo practice is off the wayside. So that's a change that Obamacare has also brought along that you should be wary of before entering medicine or before really committing to it. And then I think the last thing to mention is the universal equalizer, which is how do we function as patients in the system? Yeah. So most everyone is young, and everyone going into medicine is absolutely going to do post-undergrad education. Yeah. So the biggest change is, what does that mean for you as someone that has to buy healthcare and also has no income? Yeah. And one of the biggest improvements with Obamacare is that it increased the age that you can stay on your parents' insurance up to 26, which should get you pretty close to medical school graduation. And that has really changed what our uninsured population numbers were. Almost half of the uninsured population before Obamacare were young people, and now millions are uninsured because of this change. And then, lastly, preventative care is free. For the most part, most medical students are young and healthy, certainly young and healthy enough to do all that studying. And preventative care is one of the few things that you ever need, and now it's free.